Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And Lynn, today's topic has me worried because I think if you searched me well enough, you'd find a chicken on my person. We have just chickens everywhere around here.
Same.
Avian flu. What the heck? What do we have to do?
Yeah. So on the 18th of December, our governor declared a state of emergency. Actually, so it's kind of a big deal because of increasing numbers of avian influenza, which is identified as H5N1. And so what does that mean? So kind of looked into it. All the doctors are Twitter about this. Everybody is kind of interested in what that means. It's going to be difficult, but it's a potential pandemic risk.
Right.
Right now, it's not expected to become like another COVID-19, but it could. Viruses are clever, and they do what they want. So, but transmission right now is mostly going from bird to bird, but can also go to human and cows, and then cats and dogs as vectors. Also minks.
Minks, really?
Minks,
Wow.
M-I-N-K-S.
Okay.
Yeah. But I don't know of any mink farms around here, or even anybody who owns one.
A single mink. Yeah, I don't know.
Yeah, I don't even know
mink.
if they're feral or in the wild at all.
So-
but we do have cows, cats, dogs, and lots of chickens.
Lots of chickens all over the place. It seems everybody in this county has chickens for obvious reasons because of eggs and the prices and such, and it's very easy, and keeping chickens is easy. I've got chickens all over the yard out there. In fact, they like to hang out on my back deck. So now this isn't the... Now, bird flu has jumped before, right?
What do you mean by jump?
Jumped species and become like a human flu, hasn't it? Didn't do that like 25 years ago or something like that. There was H1N1. Yeah,
it's doing it now.
It's doing it again, right? Yeah.
And there's bird flu is kind of imprecise, so there's probably a bunch of different versions of that.
Right.
Yeah.
So, but this isn't the first time this has happened. Is there anything, do you know anything historically about it? Is there anything different about this time? Is it just that there are more people and chickens now? Or?
I think this is a stronger disease.
Okay.
I think that's the concern.
Right. Okay.
So you remember viruses can drift, which is kind of slow change in their genetic makeup and presentation, or they can shift, which is kind of a paradigmic shift. So mostly people's possibility of getting it comes from bird secretions. That's like if they sneeze on you, which doesn't happen very often. But
you gotta go out of your way to get it.
yeah. The other one is excretions.
Right,
And
and
if
that's
you've
easy.
ever had chickens, it's all over the place.
All over, exactly.
And it's mostly inhaled into the upper respiratory tract, so it's not like if you accidentally step on chicken poop and track it into the house, that's a big catastrophe.
So, but then you have to worry about how you clean it up then.
Right, spraying it with bleach, let it sit for a while, spray it again, let it sit, and then go for it with a mask on.
Okay.
Probably gloves too, although it's not transmitted that way. And right now there was limited human-to-human transmission, but like I said, if there's a shift, that could happen. That could change.
Have they seen any human-to-human transmission?
Yeah,
really?
they have.
Okay.
Yeah. And then the big risk factors right now are chicken farms and dairy, which sounds kind of like Smith River. And,
You're right.
the people who work with those animals out there are at super high risk. I would think as far as chickens go, it's not so much a problem, and I'm only guessing, this is not data-driven, not so much a problem if you're outside, but if you're inside, like cleaning a chicken coop where everything is aerosolized, that could be a problem.
Yeah. Wow. Okay.
Yeah. So it wouldn't take very many viral mutations to make this a bigger problem. Then here's what's scary. There's a high case fatality rate. This is worldwide. It's 52%.
How big is that?
That's a lot.
But how big is the sample size for that if it hasn't jumped to humans like this yet?
Well, it's jumped to humans in other countries. It's been jumping into humans a lot, actually, like in Egypt and Southeast Asia.
So any idea like how many infections that has led to, and what's that? I mean, you can throw out the 52%, but it's kind of irresponsible to do so unless you're talking about 52% of what?
Of what? See, but there's no answer there. Maybe of diagnosed cases. Okay, because there isn't super good testing normally available, certainly not here in rural Del Norte, and definitely not like, say, in Egypt.
And that begs the question then, how much should we be scared of this 52% if it can't be backed up?
Yet, I would be worried about it. I think anybody with a comorbidity should be a little worried about it. So anybody with COPD, also a Del Norte favorite,
that is true,
should be worried about it. And I think it's probably, well, again, we're in a data-free zone, but it's probably going to be a worse problem for older people with comorbidities than younger, relatively healthy people.
And that's any
that
disease, any flu is like that. Sure. It just has it such a specific. It's 52%. It's so specific, and you say we're in a data-free zone here, but that's presented like data. So I have issues with that. 52% of what? And I'd like to know more about that.
That's part of critical thinking, Paul. Thanks for bringing that up.
Well, it's also part of how I can just see, I've come across so many times. I mean, we can go back through the election if you like, but so many times in which something is said and nobody asks the obvious question about it because people just don't ask the obvious questions
anymore. How do you
get
there? Well, I think the initial illness would look a lot like the flu. Which right now, if you've looked at the CDC flu map, which kind of tells us the picture 10 days ago, California, Oregon, and Washington are definitely the amount of people with influenza are growing. And there's a lot of influenza A. And this would be a subtype of influenza A. Okay. And the clinical testing that we have here doesn't have the ability to split down the diagnosis further. So it's just A or B.
Wow. Okay.
And so I wonder if you could get a positive influenza A, think it's just regular flu and not really have an idea, making data hard to figure out and further obscuring.
Exactly. So the question is, how many, if any, avian bird flu cases are hidden just in that influenza A?
A bigger thing than we know.
Wow.
But people get sicker. So it would look a lot like the flu initially. And then what we really need is real-time access to H5N1 specific DNA test, polymerase chain reaction testing, which I wouldn't think is a big deal. I think that's just
especially after
a
COVID.
Matter of getting it.
We're getting PCR tests all over the place after COVID, right?
Yeah, this is not unknown technology. In fact, if you come to my clinic and you get tested for strep throat, that's a DNA PCR test. It takes longer. It takes 25 minutes, but there is no false positive. There's nobody who can tell me I get the kind of strep that doesn't make the strep test positive. Which is a thing, but not a very common thing.
Really? Is it a thing? Seriously?
Yeah, just certain strains.
A wildly variant.
Roll through town, but it's not as common as they think. Anyway, regular flu shots do not prevent this disease, which is a bummer. Prevention really is masking and eye protection.
And eye protection, that's new, because if you got aerosolized droplets, your eyes are just walking around with your mouth open.
Right. Yeah. So it can go in through your eyes, through your nose, through your
breather.
Kind of upper respiratory, But here's what's scary. There's a lot of pink eye going around. And
we just did an episode about conjunctivitis.
Right. And some kids who have been known to have been observed to have this disease actually only presented with pink eye.
Oh, my God.
And so I don't know how much pink eye I've treated this week. Probably about 5 people.
It would be your job would be so much easier if diseases could just stay in their own lanes, right?
know.
So how can you tell if you've got the flu, what's your, how can you tell if it's the bird flu or not?
Well, you're not going to be able to tell it at home. You're going to have to be seen by a provider. So symptoms include fever.
But you just told me there's no way a provider in this county can tell us.
Right now. So
Okay.
if we get a DNA test, we should be able to. And my guess is part of that declaration of emergency
sparking that,
is
yeah.
that,
Okay.
providing that. So acute onset, that means all of a sudden onset of a high fever. Probably,
Thanks for clarifying. It's not acute onset. It's
probably a dry cough,
I'm sorry.
pink eye-like stuff, and we call those ILIs, so influenza-like illnesses.
ILIs. Okay.
Yeah.
Wow. Okay.
Yeah. Progressing to lower respiratory symptoms. This is the rub. This is the problem, is that people get kind of a viral pneumonia pretty quickly, and then acute respiratory distress syndrome, which is, only able to be supported in the intensive care unit.
Oh, wow. Okay.
Yeah.
You're talking intubation and things like that after that, then, right?
Yeah.
Yeah.
Your whole pulmonary system collapse, respiratory system.2 incubation period is about 3 to 10 days from exposure. Now, if it's known to you that you're going to go to work on Monday with the cows in Smith River, or at the chickens, the commercial free-range hen establishments up here, and then you all of a sudden get sick like that, incubation period 3 to 10 days, I would think that you would mention that when you sought care. Probably that care would take place in Spanish and not English, which is
Wow. Yeah. Right.
going to be difficult
That is a
to
consideration.
getting the word to the population that's most at risk in our community. I think that's going to be complicated.
That's interesting. I may bring this up. This is going to be, I'm breaking whatever wall this is, but bring this up with the Redwood Voice crew to sort of ask around. I mean, because there is one family, one industry, one group of people here to approach and ask specifically, what do you do in cases like this? Because you do have a large workforce that speaks Spanish.
Right.
You work with cows and chickens,
Right.
and you have to have something in place to address these kinds of health concerns. If somebody just shows up with the flu when you've got an avian flu emergency happening, you've got to have something in place. That's a good question to ask
Right.
them.
So does the declaration of emergency mean that they have, like, at the very least, a flyer they could post or something so the community would be aware of it?
Right.
Yeah, that would be another good question for Open Doors, since they take care of actually a lot of the Spanish-speaking patients in the community.
Wow. Okay.
Yeah.
All right. See, we're working up a news story about all of this right now.
Yeah.
Okay. Sure.
How exciting. So,
And we're not alone, because I mean, any place in rural California, certainly rural America, you're going to have people, cows, and chickens. That's just going to be, unless maybe up in the Sierras or something. I don't know, but yeah, this is going to be a concern everywhere.
Right, and all the backyard chickens too.
Well, I
We
guess
already-
that's what I meant.
we
That's
already
just the
said that.
prevalence. Yeah.
Yeah.
Most people living in places like we do have backyard chickens. Most people, a lot of I don't know. Right here on our street, everyone I know has chickens.
I think they're fun, except during.
I can't stand them,
pandemics.
but yeah, that's another thing.
Oh, really? I like them. I'm a fan. So here's a pearl. Here's something to take note of.
Okay.
If you spike a high fever with the symptoms that we were talking about, so dry cough, maybe plus or minus pink eye, muscle aches, headaches, get to your provider quickly, because if it's just the regular old flu A, and you're not immunized, or even if you are immunized, you have 2 days to get from the onset of fever to get started on any medication that might kind of help you. And we don't usually say that as providers. We're like, treat your fever at home,
Right.
take the over-the-counters, which we also talked about in a previous segment about how to sort that out, because it's a little daunting. And, call us, the zithromax moment's probably going to be 10 to 14 days out. So that's when a viral syndrome, if it's going to become, kind of a secondary bacterial infection, that's when that happens. This is the opposite of that. If you think you have influenza, which is eons further than symptomatically than like a regular cold. You know, most adults, if they peak at 104 degrees of temperature, Fahrenheit, then they're freaked out. They're quote unquote really, really sick. And that's a time that you should actually come in sooner rather than later, within 48 hours of onset of fever.
So, okay, within 48 hours, because typically I'm going, I might feel, I don't get feverish, so I don't even know. I don't even know how long that would be
misery.
for me. Yeah.
And it's scary. And it's, you say you don't normally get feverish. Well, this might be a different case.
Right,
this
exactly.
will seem out of the ordinary to you.
Yeah. Okay. Wow. I was wondering too, because I mean, oftentimes, like times when I'm saying I think I had the flu, but I don't know, because you don't even end up going to the doctor. You're just sick for a few days and you get over it. But it comes on and it feels like the cold for a couple of days, and then it gets worse, and or it stays getting worse.
Right.
So I don't know. I just when to count that, because I could see me going through a couple of days going, oh, this is just a head cold. This is just something. This is just something. And then maybe I've had a fever, low grade, and then a couple of 48 hours have gone by. Is there any recourse for me? If you kind of amp into it, if you're amping into it slowly, that's not avian bird flu then, right? I mean, that's not avian flu.
No, I don't think you can say that. There's no absolutes in medicine.
Yeah.
But this is going to get your attention.
Yeah, okay.
This is going to be different than, it's, I got my cold. This is going to be acute onset. That means like you feel okay, and 20 minutes later, you're very not okay.
Right.
And that's going to seem unusual. You're going to have a lot of body aches, which we call myalgias. You're going to have a headache and just feel like I'm canceling everything. I'm going to bed.
Sure.
I'm miserable. And then a dry cough starts, maybe some nausea and vomiting, stuff like that.
Is it too much to ask somebody with the flu and going through all of that, if you do end up making an appointment and getting into seeing your provider, and that provider, as you've just outlined, doesn't have anything at their fingertips to go, oh, hey, this is avian bird flu or not?
Right.
Who raises that concern first?
Here's what's going to make that distinction.
Okay.
If you have contact with dairy cows or poultry,
okay,
or you have been around dead birds, like, my dog and I were walking down on Front Street. This was a couple of weeks ago, and there was a dead crow.
Yeah.
And, and of course my dog is like, ooh, treat.
Yeah,
like,
right.
Get away from that.
Yeah.
So, but if you like had to handle it, maybe to get it out of your backyard or something, then that should come up in the conversation.
Okay.
If the provider forgets to ask, which none of us are going to forget, and give us a week, we'll got it.
Yeah,
We'll have it down.
Okay.
Then that should be mentioned.
Okay, yeah.
Okay.
That's a good point. That's a good thing to point out, yeah.
Yeah.
Presence of birds.
Presence of bird.
Okay.
Yeah. So as of 2024, the Center for Disease Control said there were only 25 human cases. Now, this is October. I forgot to say that. October of 2024.
Okay.
There are 25 human cases in the United States with no fatalities. That's kind of interesting. So what would be the change? If we're assuming kind of a fuzzy data of 52%, I think it's because we have Tamiflu. Tamiflu's the treatment. This is where we get a break a little bit.
Wow. Okay.
Okay, so Tamiflu, I'll try and pronounce the generic Olsamtamivir, is the normal treatment for most types of influenza. So if I was sitting with you in an exam room and I asked you about birds or dairy cows and you said no, and I said, well, I think you have the flu, I'm going to give you, it's been within 48 hours since your onset of fever, I'm going to set you up with some Tamiflu.
Mm-hmm.
And I'll probably tell you it'll make you a little bit less sick for a shorter amount of time.
Mm-hmm.
And most people go for that. That also happens to be the best treatment we have now for bird flu.
No, right.
So that's kind of good luck, I think.
So is that Is that widely available? I still have trouble getting my head around that, around antivirals being widely available.
It is widely available, except sometimes in Del Norte County, there can, especially during high number of flu cases, there can be a run on the pharmacies, and you can have a little bit of a hard time finding it. I would not be surprised if the clinics don't carry it.
Okay.
I mean, I said that backwards.
Yeah.
I think they're going to carry it.
Right.
And in fact, I can almost picture the shelf where it is. So they're stocking up, but I don't know that they could handle an epidemic of bird flu, though. Mm-hmm. And then sometimes when, those magical winter moments when 101 is closed and 199 is closed and 101 is also closed to the north and the south, I don't know, how do meds get up here? Sometimes that impacts the availability of stuff. And while I enjoy that, just because I like the idea of being cut off from everyone, it still, impacts my practice.
Sure.
Yeah. So, and most of the treatment is well tolerated. People haven't had enough of it really to have very much in the way of allergic reactions. I can't even think of the last time somebody told me they were allergic to Tamiflu. But you could also treat the sick people, and there's a protocol to treat the exposures. Mm-hmm. So let's say there's an outbreak at one of the dairy farms, and they could round everybody up and test and treat everybody. Mm-hmm. And then, unfortunately, I don't know what they would do with the animals, probably be sacrificed.
Oh, yeah, right, yeah.
And there's very little resistance reported, which is super helpful.
Very little resistance
to the drug.
Mm-hmm. Oh, okay, gotcha. I got that. Okay.
Yeah. But here's another problem that people have now. When people get sick enough to be in the hospital, I think with somebody with a widespread viral pneumonia, it would be at least a thought that a hospitalist might have to put them on steroids to help with the inflammatory component of the infection so that they could breathe better. Mm-hmm. But with the avian flu, steroids are a really bad idea. So that means people with, like asthma who are being treated in the clinic, maybe they don't realize that they actually have bird flu. And the provider says, well, this is your asthma flaring up because you have a viral syndrome. Super common presentation. Mm-hmm. Then I'm just going to give you a steroid taper or a steroid blast. Now, if I was that patient sitting there, I would say, I understand that that's not a great thing in bird flu. Do you think we're really on the right track? Mm-hmm. And I bet the phones whip out and people step into the medical libraries. And
wow, okay,
yeah.
Okay.
So
wow, all right.
Yeah, so I don't know if inhaled steroids might be better than systemic steroids under that circumstance. It's hard to say. Mostly that observation comes from people who are hospitalized, and they're probably getting IV steroids.
Right.
So it could get exciting, I guess, is the bottom line. If you have, so the take-home messages are, if you have a really acute onset of illness with a high fever that's atypical for you, especially if you've been around dead birds, chickens, or cows, you got 48 hours to get to your healthcare provider. That's pretty doable in this community right now. And then mention the connection with dead birds, chickens, or cows.
Yeah, make sure they know about that. Yeah.
Hopefully in a month we'll have a way to test for that. If somebody offers you Tamiflu, now some doctors will poo-poo it and they'll say, oh, well, it makes you a little bit better and just probably knock a day off your illness. And do you really want it? The answer is yes.
Yes.
The answer is yes. So I've seen providers kind of talk, clinicians try and talk patients out of it.
Wow, why?
Because, they're in a hurry and it takes time and they don't see it. There's certain types of doctors who are minimalists, and that goes along with their theory.
Yeah,
and, there's people like me that throw in the kitchen sink. So comment don't be afraid that the doctor's going to poo-poo you. These are important points that the clinician needs to know.
Right.
Okay. And I think that people are allowed to speak at an appointment and talk about what their theory of their health is.
Mm-hmm.
So if you're an interventionalist and you like the idea, of maximizing health, then throw it out there.
I love these designations for different philosophies, and so an interventionists. What would you call the opposite of an interventionist?
Minimalist.
That's a minimalist. Okay.
Yeah, there are some people like that. Like infectious disease doctors are notoriously no.
Well, what is the reasoning? Let the infection take its course because that makes you stronger.
No, because they don't want to do anything that isn't absolutely proven by science.
Wow, they don't want to take any chances.
Yeah,
Wow,
and that takes time.
Yeah.
If you even have the testing available, which we don't really right now. So. Then there's people like me that I'm always willing to say, well, let's try a therapeutic trial.
Yeah, right.
There's no way we can really know and test, but is it going to hurt you? You're allergic to it.
That's funny.
Help you in a multiple different ways.
See, but then you couldn't be absolutely certain what worked then in the end, could you? If you threw everything at a situation.
Yeah.
But it doesn't matter. It's just that something worked.
But I think the primary goal is getting better, right?
Right. Yeah. Exactly.
So I think that would alleviate that.
Yeah. Okay.
So I'm all for intervention.
You taking any? You have chickens, as I do.
Mm-hmm.
Are you taking any considerations? Anything into consideration as far as being around them?
Well, I did
eggs?
This morning. I needed to change their water source, and I was like,
Hold my breath and squint. No.
Well, I have all that kind of stuff at home.
That's true, yeah, right?
Yeah, but then I thought, well, wait a minute, it's going to rain hard today, and maybe, and it's an open water source, and maybe it'll just dilute all that gross bird poop. Oh, wait a minute, that bird poop comes from wild birds, which also are a vector. So I just kind of am thinking about it.
So you didn't do anything with it?
I didn't do anything. I was ineffective on so many levels. So.
Oh my God! Yeah, I've got a rail on a back deck that I think I'm gonna have to turn that my back deck into a cage basically, and it's just to keep the birds off because they perch up there and they roost up there now. And
you mean the chickens?
The chickens.
Birds?
No, just the chickens. And chickens and one duck. There's a duck that comes up there and sits there. It's a very pretty duck, but still. Oh. I would just get off my deck. But then I went out there. I don't want to go out there and stand in a cage. But yeah, I also don't want to go out there and stand in chicken filth.
What I would think is, that would decrease the air circulation. And I think probably
what would
decrease?
Good. Open air, yeah.
So I guess what I would put is more like a strip to, when the cops are chasing somebody and they puncture tires. Yeah, a puncture strip and just keep them from landing there.
Yeah. I got to do that, huh? Yeah, broken glass along the top.
Sandpaper or something. I don't know. I think there's a lot of ways you could look at that.
Yeah. So I'm concerned about that because I've got easily a couple dozen chickens running. I don't even know how many are out there. As you can probably I'm not the primary caregiver to the chickens. I'm secondary to.
The chickens are the boss of themselves.
I try to stay away from them. I don't like those little things. But they're just rapey little wind-up toys. I don't like them.
But you got plenty of other birds in kind of surrounding your property. That's the thing I've got too. I've got sparrows. I've got crows. I've got. There's a phoebe hanging out. There's owls sometimes.
We had a cloud of American goldfinches come through the other day, which is really pretty. I always love seeing that. Yeah.
But now we have to squint at them and
now they're little disease bags.
Which is a bummer.
That is a bummer. Yeah, the duck's really pretty. I hope we don't have to put them all down. That's fantastic. Because that just happened a couple of years ago, didn't that? I remember there being like a mass culling of birds for this. Yeah. Did we avert this then? Is this just the same thing coming back?
Yeah.
Wow. Okay.
So the other thing I wanted to say, if we have a little time, is that our next I've got a colleague who's name right now is Ryan, who's going to be talking to us about seasonal affect disorder. And I'm super excited about that coming up probably early January.
Yeah. That's like prime time for that too, huh?
Yeah, there you go. That's something Del Norte has plenty of.
Really? Is that also a Del Norte phenomenon, along with the chlamydia?
Yep.
Oh, God.
Yeah. Right now, gonorrhea. Right now, definitely syphilis.
Post this on the tourism website.
Yeah.
Come to Del Norte. Well, that was very informative, and I will continue to be standoffish with the chickens that I live nearby for this. But yeah, I got to talk to Ralph maybe about, because he hoses off and cleans and does and interacts with them on the daily, and maybe he needs to get a mask and get him out there. Yeah, okay. Yeah. All right. Lynn, thank you. Very informative and very close to home. And we've got the seasonal affective disorder coming up. I guess I was going to ask what's going to happen next Health Matters, but we'll find out.
That's it.
All right. Thanks so much.
Bye.